Thank you, everyone, for joining us for another Learning Lunch hosted by FormatApproved.com. My name is Brian Johnson. I'm the Senior Director of Online Education with Format Approved, and I'll be your moderator today. Today's Learning Lunch is 5 easy ways to engage patients using your EHR patient portal. We're joined today by Justin Neece of IngagePatient. Justin is an expert in patient engagement whose experience extends to portal apps, patient wellness, and HIE. You can learn more about his expertise and credentials on your screen. As you read, I'll go through some quick housekeeping notes. Remember that you can ask questions of our presenter at any time during today's session by entering them into the chat area. In the second half of our session, we will address as many questions as time allows. If we do run out of time, answers to all submitted questions will be posted to our website and sent by email link later in the week. Also, remember that all registered attendees of today's session will receive an email with links to both the slides and the recorded version of this event. So if you're looking to get slides or share what you've learned with other folks, rest assured that we'll send out a follow-up email letting you do that. And sometimes people say, well, I didn't get the email. Remember to check your junk mail. Sometimes some systems will screen out that email. Well, Justin, first of all, thank you very much for joining us today. It's a real pleasure to have you.
Thank you, Brian. I look forward to our discussion.
Great. So there's so much interest in patient engagement and patient portals now with Meaningful Use Stage 2 coming. How would you define a patient portal, and what can you tell us about the different solutions that are available today?
Yeah, great question. There's a lot of confusion, I think, in the market around patient portal, practice portal, etc. The simple answer to your first question is that a patient portal is typically an online application, obviously internet capable. It is typically set up either through a website that already exists today, or it can be a standalone portal application website that has been built. The typical patient portal functionality allows patients to interact through the portal through various functionality from requesting appointments to registration, etc. I think that as we go through the questions later today, we'll dive a little deeper into more functionality, but that's the simple answer for what is a patient portal.
Okay. And what are sort of some of the features then that people should expect from it?
The most widely used pieces of that is the appointment request functionality, where patients want to set up an appointment with their physician, provider, etc. The second most widely used functionality is a pre-registration form that could be filled out, downloaded, filled out, and then brought into the practice, or filled out online through the portal. Those are the two most widely used pieces of functionality on a portal.
All right. So there's different perspectives on this. What does patient engagement mean for the ONC and HHS? And then there's the practices, and you mentioned a little bit about what the patients might expect from a portal. Tell us more about that.
Yes, good, very good question. ONC, HHS, through, as we all know, the recent regulations that now flow through meaningful use in particular, they define that now through meaningful use stage 2 is in the format that patients must be able to receive what is called a clinical summary. It's basically a summary of their encounter with the provider the day that they visit the provider, and that form of discussion must be downloaded into a clinical summary and shared with the patient, and also through an online capability, and also giving the patient access to respond to that clinical summary. There's a lot of mechanics behind that, but that is how ONC is defining it today. On the practice perspective, what we see that practices really want from a patient engagement experience is trying to prepare patients before they come into the office, which can obviously improve the patient's experience. We've all sat in the waiting room filling out paperwork on clipboards. I think the practitioners are trying very hard now to reduce that administrative burden. The other piece of this that's very important from a practice perspective is reducing what's called no-shows for appointments. The industry average on no-shows is around 18 to 20%. This has a major effect on practices and their ability to see patients effectively. And I think on the patient side, to the last part of your question, we as patients are also, I'll use the word consumers, and because we have such great access to technology for every other piece of our life today, we also want that retail experience in a healthcare format. We want to be able to view our information and understand what that information means anytime through typically a mobile device that we already use.
I think that's a great point, and I think that expectation is just growing from people as they have good consumer experiences outside of healthcare. There's really just going to be that demand that healthcare kind of catch up and offer that same sort of experience.
Exactly.
Now, you talked about this a little bit, but let's dive a little deeper here on what are the features that patients value. You know, based on your experience and research, what are the ones that they really are looking for more than anything? You mentioned the appointment and did you mention the prescription renewal? Just let's go ahead and go through it. Yeah.
Yeah, absolutely. We have found this to be true in our experience, and as you mentioned, there's a lot of research out there. But what patients really want, first and foremost, is when we talk about appointment scheduling, it's not so much about requesting the appointment, but they want to know exactly the confirmation of that appointment as well. And scheduling is a very important piece of our busy lives today. So the ability to be able to request an appointment and confirm it, again, through an online device, whether it's at home through our computer, through our smartphone or tablet. Most of the time, appointment requests are being done after hours. It's not typically during the day. So if we don't have that portal access, we don't have the ability to do that through online capabilities, it does have a negative effect on patient flow for those practices. The other pieces on here that you spoke of, Brian, the prescription renewal piece is obviously a very big want by patients today. Having, for example, your own personal health record that has been developed that you can access again through a mobile device. Within that PHR, your personal health record, you have a list of all of your current medications, and having the ability to request a renewal or another prescription is a big necessity by patients today. I think these other ones all make sense. You know, there's a growing need where patients want to be able to ask questions through, again, a secure online messaging capability. we all know that we see lots of texting today and email as well. So secure messaging is another convenient way for patients to be able to talk with their care team. It's all going mobile, as we have on the slide. Mobile access is going to be very critical in healthcare as we move forward. I don't think I need to spend a whole lot of time on that one. I think we probably all agree with that. So that's very important. And then the last one on here that we're seeing a lot of movement on is we all get the EOBs in the mail, we get patient billing statements in the mail, and we all are trying to figure out what is that. And furthermore, we're finding that patients in the market are getting turned off by, again, receiving snail mail, and being able to provide a clear view of the billing statement and allowing the patient to make a payment online is becoming a stronger want by patients in the market today as well.
Absolutely, and I think a lot of people have moved to largely paying their bills online, so it's another area where there's a consumer expectation that they should be able to do that with healthcare as well.
Exactly. I mean, it's back to your point you made earlier, Brian, that we have so many technological transactions that we can make today. When you think about being able to take a picture of a check and make an electronic deposit without having to go to the bank, these are the types of things that have to transition over into the healthcare sector as well.
And on the secure messaging front, I think this has got to be something that's appealing to practices as well. And I think it's one of those things that is kind of a maybe not widely recognized benefit that's going to come from meaningful use stage 2, because I from our conversations, there's so many practices out there that really have some HIPAA concerns around how they're communicating with patients, and having this secure messaging through a portal is going to make a big difference for them.
It is. I mean, first and foremost, you hit it on the head. Obviously, we have to communicate in a superior, secure environment. HIPAA compliant is very important. But to the benefit of what you just spoke on is that practices want to reduce phone calls, and having the ability to answer messages through a secure online capability is very intriguing.
So we've touched on meaningful use stage 2. Can you talk more about how that's going to impact portals and patient engagement?
Yes. This is the fun part of my job. That's a joke. But meaningful use stage 2 can be extremely confusing. And I'm sure a lot of our listeners today are probably laughing over that, because there are a lot of very specific understandings that we all have to have, regardless of whether you sit on the provider side or you're a technology that wants to operate within healthcare. Specific to patient portals and patient engagement, there are now some mandatory regulations and measurements that EHR companies and even providers, when they want to go through attestation to receive a bonus check for MU2 in the year of 2014, there are very specific criteria around that now. The first one I'll talk about is what we just previously discussed, which is around provider to patient communication. There are now very specific standards and criteria that has to be fulfilled for MU2 around secure messaging, and then that clinical summary that I spoke to earlier. All EHRs have to produce a clinical summary after the patient visit, and it has to be given to the patient within a very specific amount of time, and it has to be provided to them through an electronic format. So that's one big criteria for MU2. The second one is provider-to-provider communications, and this is really all around what I highlight here, transitions of care. This is where a patient may be seeing the primary care physician, and that primary care physician now wants to refer the patient to, let's say, an orthopedic doctor. In that transition of care, there are specific components and measurements that have to be fulfilled as we transition that patient to the referring physician along with their health records. So that's another important criteria of MU2 around patient portal and patient engagement. And then the last one that's on here is you would think it would be somewhat elementary, but it's actually a little bit more difficult than maybe some of our listeners realize. But now that we've fulfilled the provider-to-patient communication and the provider-to-provider communication, we now have to calculate the numerator and the denominator appropriately, and then put that into a reporting format that proves that we're hitting those metrics in that criteria. So those are the three what I would call primary components of meaningful use stage 2 that go in conjunction with portals and patient engagement.
Well, and I think those are some of the elements of it that make people a little bit nervous about stage 2. We're definitely hearing an uptick of anxiety from the practice side about how to meet all of these standards. So I think those are ones that people have a lot of questions about, and I'm sure many guests of this presentation have some of those questions. I'd encourage our guests to go ahead and ask questions. We'll get to those questions in the second half. We already have some, but please go ahead and ask any questions you may have about the subject matter today, and we'll get to them in the second half of our session. So this is a great question. What cross-system integration is necessary to meet the usage requirements? Here we're getting into kind of the complexity of it.
Yeah, yes, it's again a very good question, Brian. I think to start with, as we look at the first bullet on the slide, we need to touch on the importance of the patient experience. And I think we'd all agree that the patient experience becomes richer for all of us if we can break the code on integration, which is the question that you've asked. And what we find today in health systems, even in the ambulatory space, is that everyone has some type of a portal, but from a patient experience, asking the patient to set up an account for each one of those portals does not drive superior user adoption. And furthermore, what then ends up is for the provider and also the actual technology companies in healthcare, they're going to fall short of meeting the metrics and the standards that are out there. So that's kind of the first piece of that. But the integration discussion is really around we have to bring the EHR and the patient engagement platform together. There are EHRs that have some type of an existing portal today, but now we're really moving from just talking about an online gateway for patients to do some of the things that we talked about earlier, to now we're talking about patient engagement. And what now that's going to drive is the ability for patients to do the things that we have talked about, from requesting appointments online and actually getting confirmation, to having a secure conversation with the care team that's within the health system. We can't do that without integrating the clinical technology side with the patient engagement tools and the patient engagement platform. So that's very important in this next step.
Now here's one on the horizon that most people probably don't even want to think about yet, but Meaningful Use Stage 3 is supposed to come in 2016. What role is patient engagement going to play in that?
Yeah, well, it's I was at an event yesterday in Atlanta, Georgia, the Health Information Technology Leadership Summit, and regardless of what was on the docket from all of the speakers there, the word patient engagement was used about every 5 minutes. And my point with that is that as healthcare moves to a value-based care system, patient engagement is the utopia of making it successful. We will not be able to drive costs down and drive quality care, as I say here, significant improvement in health outcomes for all of us, including myself, without patient engagement. So what we can only say right now, and obviously this is why I say, you know, it's my prediction, is that ME3 will only increase in patient engagement requirements. There'll be more criteria around that. There'll be more measurement around that, obviously. And the other thing I think that we should all think through carefully is not trying to get extremely sophisticated. I know there's a lot of discussion around big data in healthcare now, but there are a lot of ways through patient engagement that we can deliver cost-effective, preventative engagement care plans. So that's where we see it going, Brian, in the future. It's definitely going to be an extreme push as we move forward.
So your point about big data is that, if I'm understanding you right, is that in many ways there's fruit hanging a lot lower than big data in terms of patient engagement, that just really engaging with patient on preventative care and that sort of thing is something that we're not doing well at all now, and that you see that as being an important part of Meaningful Use Stage 3. Is that a fair interpretation?
That's a fair interpretation. I'll share one stat with you that 50% of last year's high-cost claimants spent less than $5,000 in the previous year. So the point you just made, this is a very specific measurement statistic that's out there. In other words, we don't see care catastrophes prior to them happening, and it's because of this cost-effective preventative engagement. There are things that we can do that are very simple that we already have the data on, again, that can help us improve outcomes for all patients.
So a lot of people are trying to get ready for getting their patient portals going. What can a practice do to prepare?
Yeah, I think we all know one of the first big steps is communication. We all have a variety of experiences with a lot of different patients in the market. But again, we come back to the whole mobile discussion. Lots of folks are using smartphones today. We have to encourage patients to utilize their existing devices in preparation for their discussion around, hey, we're getting ready to launch our own portal that you will have access to. One of the things that we've done is developed a brief card for some of our channel partners that just speak to the what on the first side and the why on the back side. It's a simple business card with a couple of points. Those are, a couple of things to do. And then the other thing is as we've put on here, it's very important to go ahead and start gathering cell phone information, which a lot of practices are doing. I think where we're still a little bit behind on is in getting the patient's email address as well. And so those are two important pieces of information that can be collected now. And the last thing that we put on here is a web presence through Facebook. We've got 1 billion folks in the world that have a Facebook account, and there is a very high percentage within the practice that one employee has a Facebook account. Facebook can be leveraged from a marketing perspective to also communicate with your patients through a social media platform as well.
So what about patient demographics? How is that going to play into the patient portal?
Yeah, as we said on here, don't assume that only 20-somethings are expecting mobile access. It's very important that we try to continue to be flexible and give a broader point of access for patients so that we can communicate and collect information that's very important to then providing a great customer and patient satisfaction that is now proving to be very important in loyalty and retention inside the practices in the hospital environments.
Yeah, I think this is a great point because there's this cliche that, only young people are messing around on tablets, and that's certainly not the case. And also there's kind of some complacency about it, I guess I would say, which is the notion that, there's this huge generation gap in usage of this sort of technology, and obviously there may be some, difference in how widely it's adopted, but to me it's basically just a faulty assumption that only young 20-somethings are going to want to have access to this kind of information, because the same sort of consumer expectations that we're talking about previously, those apply across demographics. I mean, people of all ages use Amazon, and they're going to have similar expectations for healthcare, I think. So I really think this is a great point.
Totally agree. Totally agree.
So what's some advice you can give folks for actually launching their patient portal?
Well, yes, the first step is getting complete buy-in from the entire care team. I think that with that first bullet is that we see that the adoption inside a practice or a health system environment is not very complex, in the fact that we find that the administrators and the providers inside are really looking for more efficiency and a more effective way to communicate. So it's important that you share the rollout, the mechanics of what you're going to offer from the functionality, and we find that this can be done very quickly with your staff and folks inside the practices. It's also important that as we put on here, there are some folks that are rewarding early adopters who there's lots of different ways that you can do this with patients as well, in giving out coupons, and some of your vendors and suppliers will offer to help in the promotion of that. So there's a lot of things that can be done there from a patient adoption perspective too. I think the tougher piece of this is around making sure that the workflow within the operation is clear to all the folks who have very specific job responsibilities. As we talked about here, inbound calls, outbound calls, billing statements, each one of the components that supply information or a piece of information through the workflow of those facilities and the health system, these are the things that tend to get lost sometimes, and so it's very important that before you launch, you walk through, okay, this is how inbound calls will now work, and we'll utilize secure messaging. Here's how we'll respond. Here's who will respond. Here's how fast we'll try to respond, etc. So that's where the majority of the work is really talking through the workflow pieces and making sure everyone understands, quote, the new methodology.
When it comes to rewarding patients who do engage through a patient portal, it seems to me to make sense to do that in the sense that it's also really good for the practice. I mean, this is ultimately going to be more efficient communication for the practice, and there will be ancillary benefits too. But, as you were saying before, like practices don't want to spend all their day answering phone calls. This is a much more efficient way to do business. So that gives you room, I would think, to incentivize patients to use these communication technologies.
Yes, and patients are, as you said, they really want the access, the 24/7 access, that virtual capability, right, on their time frame when they need it.
Sure, and we were talking about the generation gap and how it's kind of oversold, but there is one aspect of it that may be true, which is that younger people tend not to even want to talk on the phone. They want to email, they want to text. They don't want to call and talk to someone at the front desk. They want to just be able to log in and take care of what they need to take care of, and I think that will also be a growing expectation. So it's interesting how that may play out. So we touched on the O&C before, but beyond the signups and meeting those thresholds, what is the key to meeting those O&C requirements and actually keeping the patients interested in using this technology?
Yes, to your point, the actual O&C requirements or meaningful use requirements are specific to 3-4 pieces of criteria within the actual certification process, but it's much bigger than that, right? When we talk about patient engagement, what we try to do and what we've learned is that you can fulfill or check the box on the O&C requirements, but the question really is that really enough, which is what you're asking here, to keep patients, quote, engaged? And the answer is no. Patients want, they want to be able to access, the richness of all of these features through a mobile application. And, while we think that it would be great to think that this is possible today in healthcare, we're still well behind in providing a mobile app for patients to be able to do all these, and more importantly, to be able to do these seamlessly with a great integration solution with the actual practice management system and the actual EHR operating system that the practice is already using. The last thing the patient wants is to come back in after they've pre-registered, let's say through the portal, and when they get to the actual office and they're handed a clipboard to fill out more information. That really defeats the purpose of utilizing and leveraging a patient portal to collect the pre-registration information ahead of time, right? Because none of us want to sit in the waiting room an extended amount of time, and none of us want to continue to fill out information. So it's important that we all work on that customized registration and deliver it back to the practice management system in EHR in an integrated approach so that the patients only have to fill out registration once for an established provider relationship. The other thing that I think is very important on here is that we need to find out what is of interest to the patients. And you know, there are a lot of simple ways to do that, but what we find specifically through a very precise, concise patient satisfaction survey. Those, again, need to be delivered electronically, so it allows the patient, as they're you know, in their daily life, be able to fill those out really less than 5 minutes. So 5, 6, 7 key questions. And collecting that information and doing something with that means a lot to patients. Hey, wow, you know, they're really trying to understand what's important to me, what worked, what didn't work. Providing that information back to the practice and then utilizing it to make adjustments in whether it's operational workflow or whether it's in your actual check-in process, etc. These are key things that we see are keeping patients engaged.
Well, and to your point about filling out the same paperwork over and over again, that's got to be just one of the perennial frustrations of dealing with the healthcare system, that it seems like every time you go in, you have to fill out the same form or a different form that gets the same information. Sometimes if you're in a hospital and you just go to a different part of the hospital, you have to fill out paperwork all over again. This drives people crazy, and it's completely unnecessary with the proper technology. So I think that would be of great benefit to patients. I mean, they would love it if they could just fill out the form one time electronically and be done with it. That alone would be, I think, very valued by patients.
Exactly.
Well, we saved plenty of time for questions and answers, and we already have some great questions from our audience. For folks who haven't asked their questions yet, please go ahead and do so. We'll get to as many questions as time allows. It's a rare opportunity to talk to an expert about patient engagement, and this is a subject that I think people have many questions about. So please let those questions, type them into your chat area, and if we do run out of time, we'll follow up with written answers to the questions you ask. One other thing I'll mention is that every once in a while people ask very technical questions. We want to give our expert Justin the opportunity to defer an answer to especially thorny questions if necessary to the written answers. Sometimes people want references to particular codes or that sort of thing, which we can follow up with. So let's dive a little deeper here on secure messaging. The question from the audience is, are there any suggested guidelines on how to manage secure messaging? My understanding is that secure messaging is a requirement of stage 2. Is that correct?
Yes. Yes, it is.
So any portal is going to include a secure messaging component, or it can't be certified. Is that correct?
That's correct. That's correct.
Well, what other advice could you give practices and providers around secure messaging?
Yeah, so it's a great question, and if I'm following the listener's question, what we typically see out in the market today is where some providers aren't ready to, quote, turn it on, even though they've adopted a patient engagement strategy. They're very concerned about, wow, how am I going to keep up if I get all of these inbound, quote, messages and or emails. So I'll give one answer to that today. There's obviously a lot of answers, but one thing to keep in mind that I think can help with the actual flow of questions, and then obviously the answers that go back. Secure messaging doesn't have to be all free-form text. So don't think of it as simple as we're just giving them a box to write an email, and now we've got to read every word and then try to decipher what they really meant and then produce an answer. Try to funnel that down into very specific options of subjects. You know, is this related to a recent appointment that you've made? Do you want to reschedule? Is it specific to a medication that has been prescribed? If so, which medicine? I use those as examples because those are typically the top two categories. It's typically around meds or around appointments, and probably the third one would be around lab results. So if there's a way that you could build your questions or the actual subjects so that the patient then can check each one of those appropriate fields, then when it gets funneled into the practice or the health system, now you know specifically what areas that are of interest to the patient. Those may get funneled to different folks as well, and then those answers can be much faster produced and not so much free-form text. I think that's what worries everybody, is that it's a free-form text email. And while that is part of it, and it can be part of it, it doesn't necessarily just have to be free-form text.
All right, let's ask another question from our audience. What should people do if their EHR company doesn't have a good patient engagement solution?
Well, being very biased, I would say you need to talk to us. But it is not something uncommon.
So I have to imagine, sorry to interrupt, but I have to imagine that as EHRs are kind of scrambling to meet these stage 2 requirements, it must just be all over the map in terms of some probably just have minimal patient portals that barely meet the requirements, and others probably have pretty good ones. So there's got to be just all sorts of different technologies out there.
There are. To your point, Brian, it's all over the board. What we see, which is why we do what we do, which is not trying to be an EHR. We are partnering with a lot of EHRs to deliver the question that was asked by the listener, and we do that in multiple ways to give that practice or that health system the capabilities and the ability to integrate with their existing EHR. So there are folks like us that are out there that just focus in patient engagement, and quite frankly, there are a lot of EHRs who are much more focused on the clinical capabilities of Meaningful Use Stage 2 and not so much around the portal and patient engagement piece. and they utilize someone like us to bring those capabilities to the party.
Well, and for people who are interested, we're going to share this URL with you again in a moment, but you can visit engagepatient.com to learn more about that product that Justin's talking about. But it just makes sense to me that, you know, a company that's actually focused exclusively on those tools is going to develop a fuller capability and a better patient experience than an EHR. For them, it's kind of an afterthought for many of them, I'm sure. So that makes a lot of sense, especially if you're looking to do more than just meet the MU requirements. If you're really trying to take that to the next level, it just makes sense to me that you would have a better product.
Yes, and that's what we find, Brian, in the market is that, you know, for MU1 there were some very, very basic pieces, and everybody just decided to your point, you know, we sometimes say in the industry, check the box and build that one or two pieces of code to check the box. But now with MU2 and then further with MU3, EHRs are now saying, you know, this isn't something that we really want to focus in.
Sure, and you know, there's really, after all the expansion of EHR products after MU1, now we are starting to see that winnowing that I think a lot of people have expected, is some of these companies, frankly, are just finding it too difficult to meet the standards.
Yes.
Well, let's go to another question from our audience.
Okay.
Do patient portals have to be certified to include their reports in Meaningful Use Stage 2?
I wish I could ask a clarifying question on that.
Well, go ahead and ask, and maybe our guests will follow up as well. What would be the follow-up you would ask?
Yeah, the question, I think what they're alluding to is we're talking about, and this is the word or words that MU2 and ONC uses, which is the clinical summary. And I think what they are asking is, can they post a clinical summary to the portal if it is not certified? And that question, the answer to that would be no, they cannot do that. It has to be integrated with the EHR, and it has to be certified under the EHR requirements. And then to take it one more step, when their providers decide to get in line to go through attestation to get a bonus check, they're going to have to prove that those steps are also met, that they're using a certified tool, and that it is fully integrated.
All right. Well, we'll see if there's follow-up. But I think that yeah.
Okay.
Oh.
No problem.
No, actually, the guest just said thank you. That does answer the question. Great. All
okay,
right.
Awesome. I think that's what they were saying. Okay, great.
All right, so let's ask another question from our audience then. This is a good one. It's kind of a detail here, but it's an important one. Does a patient requesting a medication refill via the patient portal, does that count toward that required 5% secure messaging threshold?
No, it does not. Yeah. It's a great question, whoever asked that. That is a separate, that's a separate criteria and a separate measurement. When we talk about the 5%, which they alluded to, the 5% is specific to, again, I'll go back to the clinical summary. So they have to prove, the provider and the EHR together have to prove that 50% of their patients are receiving the clinical summary through an online tool. So that's the 50%. But now we get to the 5%, which is the question they were asking. 5% of the patients have to do view, download, or transmit of the clinical summary. So the 5% that they alluded to in the question is specific to the patient either viewing the clinical summary, downloading the clinical summary. And what that means is they could download it and save it to their quote Dropbox within their PHR, or the third part is that they are transmitting it to another person on their care team. So that's the 5% metric, and that's what you have to prove. It's not inclusive of an e-prescription.
All right, great answer on that.
Great question.
So here's a question for people who are, kind of in those critical access areas, you could call them. What do you suggest for a practice with 75% senior citizens in a rural area, and most of them don't even have internet in the home?
Yeah, this is a great question, and we are working with a couple of critical access center hospitals, and we have run into this. Being very transparent and very candid up front, there is no perfect answer for this, but let me suggest a couple of ideas. The first idea is around the fact that this particular demographic doesn't have an email address as well. In our capabilities today, at the time of the encounter, we are able to create an email address very quickly through some capabilities that we develop. And then the second piece of that is that we are able to allow the access and assign access to a caretaker. What that then does is now allows for that particular demographic that we're speaking to the ability to share their information with a caretaker. My parents are elderly, and I am caretaker for them, and I have done this for them. The second thing, just real quick, Brian, I want to hit on too, is that through our research and studies, what's very interesting, and it goes back to our previous discussions, is that a very high percentage of this demographic, when they still come into these rural area or critical access center environments, they all still have a cell phone. It's a very staggering revelation for us. And so therefore, my point with that is that we tend to think that, okay, they don't have a computer, they don't have a tablet in this new technology form, but the majority of them do have a mobile device called a cell phone. So there are still ways that if you connect with the right patient engagement platform and tool, we can still speak to those patients through the device that they currently have, which we're finding even in that older demographic, they do have cell phones. Hopefully that gives a couple of ideas. Again, there's no silver bullet with the question, but hopefully that can provide a little bit of color on that.
Are there some exemptions available if you're in areas where there's not the threshold of internet usage? I know that applies in some areas. I can't remember if it applies to patient portals or not.
No, not today. All the measurements are still built around the criteria of, quote, an online electronic access. So, yeah, in today's current ONC requirements, there's not.
So here's another question about the capability for messaging. The portal, should the portal be able to handle attachments like lab reports and that sort of thing?
Yes. Yes, absolutely. Yes.
So that's one of those core capabilities. Is that required, or is that just something they should expect?
It's not technically required yet. And back to this clinical summary, Brian, if you were to get your lab result today, nothing against you, Brian, but the majority of consumers, you're not going to be able to decipher what it actually means on the piece of paper. And so where we've moved to now is a CCDA for simple words, and actually they use these words, human readable format, which converts to the clinical summary, which is an interpretation of the encounter that gives the patient, hey, this is what the doctor told me, here were my vitals, these were the meds that were prescribed, he asked me to go get lab work, and this is what that entailed, etc. So we're converting all this information now into a clinical summary, and that's what has to be posted online. Now, patients want their lab results. Patients want, if you get anything from a radiology perspective as well, images. And so what great patient portals will be able to do is allow the patient to then accept those documents and save those documents into their own sort of health folder, health library, so that they can further access those and then utilize those as they get referred to other providers and physicians within their network, so that they have one place, one repository that has all of their continuum of healthcare in that location.
Yeah, and again, as we've talked throughout our session today, I think those expectations are going to be there from the patients. They certainly are not going to understand why they can't have access to that information when it's one of their main wants, I would think, in using a patient portal.
It is. It is. It's a driving increase in what the patient wants to have access to. You've got it.
So if your patient portal doesn't have that capability, that's definitely something where you may want to look at other solutions. I'm afraid we're out of time for questions. We didn't get to all the questions. We had a lot of great ones from the audience, but I want to remind our guests again that we'll follow up with a written response to these questions. So if we didn't get to you on the air here, just wait for those written responses, and Justin will be happy to answer those questions for you. I want to thank you, Justin, for joining us. This is a great session on a subject that there's a lot of interest in today, so thank you.
Absolutely. Thank you, Brian. Thanks to ForMed Approved as well for allowing me to talk to your audience, and it was a great question, great session.
Well, we want to encourage people to learn more about the tool offered by Justin and IngagePatient. Go to www.engagepatient.com. That's engage with an I in the beginning there, so make sure you spell it properly. But if you're looking for a portal solution, they have a great product that you should learn more about, so do check out that website. I want to thank our guests for joining us today. Remember that all registered attendees of this session will receive an email with links to both the slides and the video recording of this session, along with those written responses I talked about before. For comprehensive training in meaningful use, register for ForMed Approved Certified Meaningful Use Professional, or CMUP, course. The course covers the requirements for both Stage 1 and Stage 2 of meaningful use for both eligible professionals and eligible hospitals, along with clinical quality measures, HIPAA considerations, and more. Visit the URL on your screen. That's www.formadapproved.com/education/courses_cmup.html. Sorry for that mouthful. And in the slides, you'll just be able to click on that link and visit the course, learn more about it, and register. There's certainly a lot to learn with Stage 2 on the horizon. Visit formadapproved.com to learn more about our upcoming Learning Lunches. The Learning Lunch button there on the bottom of the screen will take you to our slate of upcoming webinars where you can learn more and register. Our next Learning Lunch will air on November 19th, and we'll cover the subject of what can you do to prevent a CMS audit. CMS is about to launch a new audit regime around the Omnibus Final Rule, so I'm sure there's a lot of interest in that question as well. Keep an eye on your email box and our homepage for other upcoming topics, and thank you again for joining us today.